Good morning, everyone. Today we'll discuss medication side effects and adverse effects, terms often used interchangeably, but they're not the same. Jordan, can you guess the difference?
Side effects are expected, like drowsiness from antihistamines, but adverse effects sound more serious, like an allergic reaction?
Excellent start. Side effects are predictable, often mild reactions, for example, nausea with antibiotics. Adverse effects are harmful and sometimes unpredictable, like liver damage from prolonged acetaminophen use. Nancy, why does this distinction matter in pharmacy?
Because we need to warn patients about side effects but act fast if they have adverse effects?
Exactly. For example, statins often cause muscle pain, side effect, but if a patient develops dark urine or severe weakness, sign of rhabdomyolysis, an adverse effect, they must seek help immediately. Can you think of another example?
Chemo drugs causing hair loss, side effect, versus dangerously low white blood cell counts, adverse effect?
Perfect. Now, how should pharmacists respond if a patient reports an adverse effect?
Stop the drug, document it, and report it to the FDA's MedWatch program?
Yes. Reporting helps track drug safety. Lastly, always remind patients. Call your doctor if you experience dizziness and drowsiness. Clarity saves lives. Great discussion, everyone.
Thanks, Dr. Booty. This really helps me counsel patients better.
My pleasure. Next week, we'll dive into drug interactions. Keep those questions coming. After watching the video, answer the following questions. 1. Why is it important to differentiate between side effects and adverse effects when counseling patients? 2. How would you explain the difference between side effects and adverse effects to a patient using simple language? 3. What steps should a pharmacist take if a patient reports an adverse effect? 4. Give an example of a common side effect and a related adverse effect for NSAIDs, for example, ibuprofen. 5. How can pharmacists reduce the risk of adverse effects in patients taking high-risk medications, for example, warfarin?
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.